they have very bad jobs, they live in very unsanitary conditions. So if emergency healthcare settings is the only access they have to the healthcare, then it is obvious that they're going to wait till their injuries, incapacitate them, or wait for complications of certain diseases like diabetes to access healthcare, which in turn costs a lot more for the health system than if adequate primary care or preventative care was ensured. So I have just some figures here. The federal medical treatment.
You need to start on to your proposal now.
Okay. Well, I'm going to mention this after. Just a quick introduction. I'm Alfonso. These are my colleagues, Aiden and Lulu Destroys. And so we as a pro side argue that it's both effective and ethical to provide healthcare services to undocumented immigrants. So currently in the United States, there are 36 million immigrants. 11 million of these are undocumented. And it is important, the consign mentioned this, but it's important to recognize the legitimacy of the global movement and that it responds to the macroeconomic factors and not just the desire of crossing the border to gain social benefits. So it is important for the U.S. economy, it's important for U.S. society, and in this discussion we will base our analysis on objective facts, not on political ideology. So the provision of healthcare to undocumented immigrants is a question of human rights, which, as we all know, well, everywhere except in the United States, is a fundamental right. And of simple economics, which my colleague Lulu will be presenting. So from my part of the presentation, I want you to keep 3 points in your text, which is, number one, is the main reason that migrants come to the United States is because of economic opportunity, not for the possibility of social benefits. The Personal Responsibility and Work Opportunity Reconciliation Act of 1996, or so-called welfare reform, was introduced with the explicit intention to diminish migration by withholding social benefits for migrants. In spite of this legislation, a decline in U.S.-Mexico migration was not observed until the mid-2000s. So in 2006, we had 1 million immigrants coming to the United States, approximately. And in 2009, these figures were reduced to 650,000. So the only thing that happened between that period was the economic crisis. Furthermore, migration is a risky and self-selective process, and newly arriving immigrants possess a health capital that is on average better than the American worker counterpart. So these migrants arriving in good health and they're seeking economic opportunity, they're not here for the social benefits. So the second point is that the current paradigm of care for immigrants is the emergency healthcare setting. So we know that 53% of undocumented immigrants lack insurance, which makes emergency settings their majority source of care. There are other programs, such as the Migrant Health Care Act of 1962, which sponsors about 400 clinics around the United States. But there's a scarcity of material, nobody wants to work there. Workers have very, very bad working conditions, so they can't go in normal labor hours. And according to the Institute of Medicine, $34 to $38 billion were the approximate costs of these uninsured persons in the United States. And the Federal Medical Treatment and Active Labor Act mandates that anyone who requires care must be treated. So the U.S. government has special provisions for undocumented immigrants, which are $275 million. So you can see the discrepancy between the costs and what the U.S. government is giving. Therefore, it is inadequate support for emergency-only health care provisions to undocumented immigrants. The third point is that undocumented immigrants not only work in highly demanding manual labor, but live in very unsanitary conditions. Given that working conditions are so hard and so hazardous, there's no surprise that few American citizens would actually want to take such jobs. Immigrants in low-skilled and poorly paid jobs account for 60% of all occupational injuries and have the highest fatality rates among workers. In addition, we see high rates of infectious and deadly diseases such as TB, HIV, diabetes, high incidence of obesity, high incidence of coronary heart disease. And because emergency settings are their only point of access, they wait for these life-threatening injuries and diseases to incapacitate them. So we should not be asking ourselves, why is our emergency settings not effective, but actually considering the options that we have.
So, as our honorary colleagues have illustrated, the debate around providing healthcare insurance or healthcare provision to undocumented immigrants does boil down to economics. Critics claim that they are freeloaders. They claim that they're costly, that they place additional burden on the public healthcare system because they use services, yet contribute little back to the formal economy. However, when one considers the amounts to which undocumented immigrants truly contribute to the economy, it becomes evident that these arguments are rooted in ideology rather than fact, and that the denial of primary healthcare is unambiguously unethical. Undocumented immigrants fill jobs that no American citizens would want by dint of the poor working conditions associated with them, as my colleague Alfonso pointed out. And in doing so, they make up an incredibly large proportion of the economy, and their cheapened wages the livelihood subsidies that American consumers enjoy. In the United States, essential industries including construction, service, and agriculture are heavily reliant on the employment of undocumented immigrants. For example, 70% of the agriculture industry is worked by immigrants, and of these, 50% are undocumented. These workers are paid, on average, 45% less than their native counterparts, and this disparity in wages translates directly into savings for the consumer. Americans pay less for food than citizens of any other industrialized country, and this is as a direct result of food subsidies afforded by cheapened wages by undocumented immigrants. The case for California quantifies how much of the economy is reliant on the work of undocumented workers. The Californian agricultural industry is worth more than $25 billion and accounts for half of all major U.S. vegetable and fruit crops. Of this total revenue, $25 billion, 12.5 is contingent upon work of undocumented immigrants, who make up over half of the human labor needed to sustain this industry. In Texas, it is estimated that undocumented immigrants account for almost $18 billion of the state's economic output. Lastly, the assertion that undocumented immigrants deplete resources is simply untrue. On the contrary, they contribute money to Social Security funds, and of course for services which they will never be able to access. The National Research Council estimates that undocumented immigrants pay on average $80,000 per capita more in taxes than what they will use in government services over the course of their lifetime. To add further to the injustice, it is estimated that approximately $7 billion in Social Security tax revenues and $1.5 billion in Medicare is collected annually from these undocumented workers who do not have valid Social Security numbers. Of course, these factors figures do not include other regularly levied taxes, such as consumer and sales tax, which of course undocumented immigrants still pay because they purchase things. So this brings us to a fundamental question. If any other person contributing labor and paying taxes is eligible to access basic social services, why is it that this highly productive population contributing the same is systematically barred from accessing these same benefits? We cannot deny the inherent hypocrisy in welcoming immigrants to fill labor needs at the lowest rungs, yet refusing to offer them social services in return. This strategy is not only unethical, but is also counterproductive. From a basic economics perspective, by withholding much-needed healthcare services, we're conceding to a huge proportion of potential revenues lost, workdays missed from preventable illnesses. Health is at the cornerstone of economic growth. Therefore, it would be in the best interest of the American economy to have healthcare services extended to undocumented immigrants, so as to ensure the sustenance of a healthy and productive workforce.
We believe that a unified approach to delivering primary healthcare would be a far more effective model than is presently observed. In contrast to some of the comments of my colleagues, some states have refused to comply with restrictive laws like welfare reform. For example, Washington and Arkansas states have developed programs to provide health coverage for immigrant children and pregnant women. Yet forcing individual state governments to cover this nationwide burden is ineffective and strains limited resources. It is our opinion that this circumstance represents an opportunity for positive change, benefiting both immigrants and U.S.-born populations. Given existing disparities in healthcare access based on race and socioeconomic status, we can work to create a more inclusive health system for all residents. Now, I've already spoken previously about the children of undocumented immigrants and given you some statistics. I would just like to reiterate that we risk creating a stunted subset of Americans which represent an increasing proportion of the birth cohort. We must act to abolish the growing gap in access to social services designated on legal status and recall the indiscriminate ethical principles of medical provision to the sick. In summary, undocumented immigrants are an essential component of our functioning society. They perform physically demanding and dangerous jobs. They contribute extensively to key economies and maintain low consumer prices. Despite their contributions and their U.S.-born children, they and their U.S.-born children are systematically excluded from basic healthcare services. Therefore, we argue that providing healthcare to undocumented immigrants would be ethical and effective. Our current situation of withholding basic medical access to an economic linchpin of our society, especially at a time when economic growth is desperately needed, is incredibly short-sighted and is unethical.